Hello and welcome. India has reported 10,929 fresh COVID cases today. That's 14% lower than yesterday, and 3,392, deaths in the last 24 hours. The daily rise in new coronavirus infections has been below 20,000 for 29 straight days. And less than 50,000 daily new cases have been reported for 132 consecutive days now. The daily positivity rate was recorded at 1.35%. It has been less than 2% for the last 33 days. The weekly positivity rate was also recorded at 1.27%. It's been below 2% for the last 42 days. This is according to the Health Ministry. And the cumulative doses of vaccines administered in India so far under the nationwide COVID-19 vaccination drive has exceeded 107.92 crores. And with this in mind, what do we need to do to protect ourselves and our loved ones going forward? Joining us on the show, Dr. Randeep Guleria, the Director of the All India Institute of Medical Sciences. Thank you, Dr. Guleria, for your time. First and foremost, happy Diwali. I hope it was a good one for you. Unfortunately for you, me and all of us in North India, Diwali brought about horrific air pollution, a blanket of toxic smog in Delhi and the NCR and other cities after our firecracker ban really went up in smoke itself. So let me just bring our viewers up to date. We had a thick blanket of toxic smog that gripped Delhi and nearby cities for the second consecutive day on Saturday, as the National Capital Region continued to suffer from a post-Diwali hangover. At 8 a.m., Delhi's air quality index, or AQI, was 449. That puts it in the severe category. The AQI in the adjoining areas of Noida, Gurugram, Ghaziabad, Greater Noida was even higher. And they're expecting relief only on Sunday evening, on the 7th of November. And even then, AQI will fluctuate within the very poor range. That's what the SAFAR organization has said. PM 2.5 levels have been the highest in 3 years. So my question to you, Dr. Guleria, air pollution firstly affects the lungs, those with heart problems. This has been the first real Diwali post the pandemic. A pandemic where the coronavirus affects those who have vulnerable lungs and heart disease. So what does this gas chamber that we are living in right now mean for our fight nationally against the spread of the coronavirus? What does this mean for those who could catch COVID now? What does this mean for those who have recovered from COVID?
So I think it's a very dire situation, and we talk about this every year that we need to do something, but we land up in the same situation every year around Diwali and during the winter months, where we have AQI in the entire Indo-Gangetic belt in the severe range. And we talk of the acute effects, but I'm also concerned about the long-term effects. For so many years, children and young people have been living and breathing this air, and it's affecting their lungs, their cardiac function, blood vessels. And there is data emerging that this causes long-term harm and even increases your lifespan. Coming to COVID itself, there is data from SARS and now there is data from Italy and from the US, which clearly show that when you have areas of high pollution, then the people who have COVID tend to have more severe COVID, and the mortality also goes up. And this seems to make sense because COVID affects the lung, air pollution causes inflammation in the lung, and if the lung gets sort of doubly stressed out because of the pollutants and COVID, and this leads to more severe disease, causing higher hospital admissions and death. Also, those who have had COVID and have lung damage in the form of lung fibrosis, breathing in air which is toxic also causes breathing difficulty. Then people start having chest tightness, coughing, and breathing difficulty. Some of them have even wheeze from the chest, needing to increase their medication, and at times also may need to increase their oxygen requirement.
So you're predicting a worsening of lung infections, especially among those recovering from post-COVID complications. So what about also those who have recovered from COVID exercising in these conditions, in this environment? Is that recommended at all?
So not only COVID, but those people who have chronic respiratory diseases like with underlying asthma or the elderly, I would really say that they should not only stop exercising, but even they should avoid going out when air quality is so high, especially during early hours of the morning when the ground level pollution is very high. So I think those who go for morning walks should really avoid going for morning walks, especially the elderly at this time of the year. Many people start having breathing difficulties, choking sensation, and those who are underlying bronchitis and asthma, there is data, and we've done this study 2 years ago where we looked at patients coming into our emergency, children and adults, throughout the year, and clearly showed that when AQI deteriorated, in the subsequent 5 to 6 days, there was a huge surge in the number of children and adults coming in to the emergency with respiratory problems. So there is a link between emergency visits, hospitalization, and poor air quality, especially in those who have underlying lung problems.
Very, very, very worrying, and something doctors have been repeating every year. Still, it just seems to fall on everyone's deaf ears. That said, this is the first year that since the pandemic, and everyone seems to have celebrated with a vengeance, similar to revenge tourism that we saw after our lockdowns. So what do we need to watch out for, doctor, over the next 2 weeks in terms of numbers? What are we looking at when we monitor the number of cases being reported daily, etc.?
So I think there are two things that we need to look at. One, of course, is the trend in terms of the cases. And even if there is a slight rising trend, one should get alert and have aggressive surveillance in that area to see whether the rise in cases is related to any new variant and whether we need to be active, because we are seeing surge in cases in Europe, which is being linked to the Delta and the Delta Plus variant. The second important thing that we need to do is to start looking at surveillance in hospitals. Is there increased hospitalization which is happening? Because often we see that in people who have been vaccinated, they may get a mild illness, may have increased numbers, but it may not affect in terms of hospitalization and death. So the concern is the virus now becoming more infectious? Are we seeing more cases in terms of breakthrough infection because of the effect of the vaccine coming down? Or are we seeing more vicious strain which is causing more hospitalization and death, which is a bigger cause of concern, because that will lead to strain in the healthcare system.
And I know, doctor, that you have been a proponent of schools reopening, but the Delhi government's decision to open schools after 19 months, a few days before Diwali, do you think that was ill-conceived? I mean, do you think our planners should have planned to reopen schools if we waited for so long to reopen schools at least 2 weeks after Diwali, because everybody's been going out and about, and after we've gauged the increase in cases, because that's the gestation period for the virus?
So I think schools have been closed for a long time, and that's why I had been sort of a proponent that schools should open, because many children, especially the marginalized children, had actually not had any education for almost 2 years. There have been school dropouts, especially in young girls, and therefore there was a lot of concern about education and also character building and social development as far as children were concerned. And as you rightly said, in Delhi we've been seeing that the cases are low, so it was a risk-benefit analysis that it would be worthwhile to open school, but under close surveillance and making sure that all these teachers and the school employees are vaccinated. That area is under surveillance, so that in case there is a slight increase in number of cases, we could again shut down. We still need to
Doctor, my simple question, a lot of parents are now grappling with whether, because schools have reopened, not just Delhi, Tamil Nadu, other places. What advice would you give to parents? Many parents seem to be saying they should wait for 2 weeks after Diwali, because everybody's been going out, markets have been chock-a-block, etc. Or should they start sending kids from Monday? What would you advise parent?
So my advice is that we would have to take a calculated risk, and I would say you could go to school, because this crowd is going to stay on.
Okay.
We are not going to see that crowds are going to sort of disappear, or people will now suddenly after Diwali start wearing masks or have physical distancing. You have to just travel in the metro to see that the metro is not chock-a-block. And this is going to be like that in the next, for months to come, because that is the way people travel in Delhi, because that is the most convenient way of traveling.
Understood.
Similarly, you go to a shopping mall, it is crowded, and this will happen even up to Christmas or during the winter break.
Fair point.
So I think we need to accept that, and then just be vigilant, have very close surveillance, have a plan in place so that in case cases increase, we have some action that we can make sure that we don't allow it to spiral out of control.
I want to move on to the next big point of the week. We seem to be entering an era of these anti-COVID pills. This week we saw the US pharma giants Merck and Pfizer announcing encouraging results for oral antiviral pills, and this could open up the new chapter in the fight against the spread of the coronavirus or the pandemic. This is treatment, doctor, that people have been seeking since the start of this global health crisis. Now, after months of research, Merck and Pfizer say they've reached this elusive goal. Your thoughts, what is the significance of this? Why is this important? Is the efficacy of these drugs, these pills, confirmed?
So I think what we are seeing is a lot of research now going into develop antiviral drugs. There was the initial research was predominantly as far as vaccines were concerned. Yeah. And now Pfizer and Merck and other Indian companies also doing a lot of research to look at antiviral drugs may be useful. The drug that Pfizer has come out with has doesn't allow the virus to replicate. Merck's drug is also the same. It inhibits viral replication. Pfizer's drug is a protease inhibitor. It is combined with another dose of a drug which is also given for HIV positive patients to increase the potency of this drug. The data is only out as far as the company is concerned. We need to have it peer-reviewed and to be looked at as far as the research is concerned, but whatever they've said seems very encouraging, and I think this will also be, if the data is correct and it is validated, that this will be very useful, because this is something that can be given early in the form of a pill. Remember, the other drug that we have in this stage are monoclonal antibodies, which have to be given through the parenteral route. So having oral tablets which can be given would also make a huge difference in our fight against COVID-19.
All right. Okay, we're going to go in. We have to go in for a short break. But after that, I want to ask you about this new alpha COVID variant supposedly detected in dogs and cats. A lot of pet owners worried about that. We want to assuage their concerns. So we'll come back quickly after a short break. Welcome back. Let's talk about COVID and pets. This week we saw a report that claimed that, the alpha COVID variant, Dr. Guleria, has been detected in dogs and cats. And this has, of course, led to many concerns amongst organizations that work with animal rights, that people will, panic and start throwing their pets out of the home. Dogs and cats in contact with humans have tested positive for COVID-19 in the past, but is there any evidence at all, Dr. Guleria, that animals can transmit the disease to humans and spread COVID-19, or is it only human to animal is the spread?
So the current evidence suggests that this is uncommon and the spread is predominantly from humans to animals. This has been reported with the alpha variant, which was the variant which was first detected in UK last year in September, and then caused a surge in cases in UK, and we had this variant also in India just before the Delta variant came. This variant has been shown now to be there in pets. Even the older Wuhan variant, there was reports, I remember last year, from a zoo in New York, where the tigers and the lion out there had got COVID-19 from a zoo worker who has tested positive for COVID-19. So it's known that rarely this virus can jump species and go back into, especially pets like animals like cats, dogs, or lions. And but the reverse is not there. It's not been reported, and it's very rare to really say that it will jump from pets to humans. The only other concern is that the alpha variant in pets has been shown to cause moderate to severe disease in them, causing cardiac involvement in some of the pets. They can have sometimes a serious involvement as far as pets are concerned.
Okay, so it could be serious for the pets, but I want to just reiterate, thank you, doctor, for clarifying that there is no evidence that animals can transmit the coronavirus to humans, that animals can spread COVID-19 to humans. Thank you, doctor. I want to go across to the big story, of course, internationally, is what is behind the record high daily cases in Russia. Russia is reporting the highest ever daily COVID counts. They are even giving paid holidays to their citizens. to curb the spread of the infections. Nothing seems to be working. But Dr. Guleria, I remember at the height of the pandemic when when Indians couldn't travel to most countries, Russia was one of the countries that was allowing Indians to travel without having to quarantine when you land, and you could see so many of our stars, etc., taking trips there. Are the two related in any way, and what your thoughts really behind why we're seeing such a high daily caseload in Russia?
So I think in my mind there are 2 or 3 reasons. One reason is that now the Delta variant and the Delta Plus variant, which caused this huge surge in India, is now sort of spreading to other parts of the world, and we know that this is a very infectious virus in this variant. We saw that in our second wave, the cases really surged in a really exponential manner, and we are seeing that now the Delta variant is actually becoming more dominant globally. And the second issue is that the vaccination uptake in Russia is very low. For some reason, despite the fact that they have their own vaccine, the Sputnik vaccine, the number of people who are taking the vaccine in Russia is very low, and that is also leading to less number of people infected and more susceptible population. This combination is leading to the surge in the number of cases. But like I said in the past, we need to be very vigilant with our surveillance, because whenever you have a surge in number of cases, one is always worried about new variants or a new variant of the virus coming, which may actually cause breakthrough infection or more serious infection in other parts of the world.
Okay, let's talk about boosters, Doctor. COVID-19, the UK has cut the booking time for the booster shot by a month. That's what the health service announced today. 1 month slash. At this, I think Germany has agreed to booster shots for all. Boosters seem to be the norm across the world increasingly. What about us here in India, especially when we're still to vaccinate everyone?
So I think we need to look at it from the science point of view and the ethics point of view. If you look at it from the science point of view, a lot of boosters being given more like because of fear of infection happening. But if you look at data, even data which is emerging from Europe, from US or from our own country, we are still finding that those who have been vaccinated are still not getting serious infection. The vaccines are holding out in terms of preventing serious infection and deaths, even in our country and most parts of the world. So currently, to say that we need a booster may be premature. I do agree that at some point in time we will definitely need a booster. But I don't think we have enough evidence to say that we are seeing a lot of breakthrough infection and the vaccines are not working now. We have people who were vaccinated in December in UK. Yeah. And we are seeing that there is a surge in number of hospitalization in UK now, even with the Delta variant. So the vaccines are working. The second important thing is the ethical part, is that if you have a large part of the world which is not even for one vaccine, then without having data and the boosters seems a little unethical, because we have entire continent of Africa where vaccine availability is around 25%. And we know that if we are not able to vaccinate everyone, we will not be safe. So unless everyone is safe, no one is safe, and we must keep that in mind. And therefore, I think globally we should try and vaccinate as many as we can before we really start aggressively thinking of a booster dose.
And that's why this was on the top of the agenda as leaders from the world's T20 leading economies met in Rome for their first in-person G20 summit since the pandemic, and international economic recovery, climate change and COVID-19 vaccines, the supply chain crisis, energy prices were the issues on the agenda. The G20 wants 70% of the world vaccinated by 2022. Doctor, I mean, are we on track? In fact, compared to the last G20, which was a virtual G20, they made the same promises then, and our vaccine inequality seemed just as stark. Do you think we could be on track by 2022?
Well, I hope so. It's a big challenge, but unless all nations come together, I would say even the manufacturers come together and allow vaccine manufacturing to occur at different sites and open up their sort of plants to others, we will have a huge challenge. I think this is a time where the community should come together, both the pharmaceutical industry and world leaders, because we need to really look at this as a global challenge, and try and fight it as one human race rather than looking at it bits and pieces, because that will actually allow the virus to really spread more. It will take a longer time and it will cause more deaths.
All right, last question, Doctor. This week we of course got the WHO nod for India's Covaxin. We're now waiting country-specific approvals from the UK, Canada, etc. But some questions being raised about more data needed for Covaxin for pregnant women. Any thoughts on that?
So I think there is data which is there in our country, and that was the reason why approval was given by the regulatory authorities in India. But I understand that the WHO would want more robust data, and I think that is already being provided. So I think in some time we should get approval even as far as pregnant women are concerned. This is a vaccine platform which has been used in the past also for many vaccines and have been found to be safe. So I really don't think that there is there should be any problem in getting the approval for pregnant women. Obviously, everyone wants to be careful when you're looking at vaccination for pregnant women, because safety is of prime concern both for the mother and for babies.
Dr. Guleria, that's all we have time for today. Many more questions, but we've run out of time. Thank you so much for joining us tonight. Bye-bye.